And there has been a medicalization and a pathologization historically of transgender individuals. And so people have experienced judgment, patronizing, humiliating treatment. And so, of course, that's going to be a barrier to any future care. Even as simple as intake forms and office environments are not, for the most part, trans-inclusive. So that's going to be a barrier to care as well. And then just coverage issues in terms of some of the things that people want to access are not covered, or certain parts are covered and other parts are not, and we can get into that a little bit later. I think Dr. Mazzarella will also get into that. And there's just no wait list for everything, so these are all barriers to good care. In terms of standards of care, and again, Dr. Mazzarella will go through some of the hormone treatments a bit more, but there are some really great standards of care. These are just some of them. There's also the Sherborne Health guidelines. There's some stuff out of Vancouver Coastal Health, which is excellent. So there are some great standards of care that are available to everyone. Dr. Mazzarella will go through this a little bit more, but I'm just going to briefly touch on gender-affirming surgeries. That surgery is an effective intervention for patients, for individuals who have gender dysphoria. And people always worry about, what if we make a mistake? What if we, approve quote-unquote, someone for surgery, and then they regret it? The rate of regret is so low that it's just something that I don't worry about, truthfully, okay? And I do work at CMHA Gender Clinic, which we can get into, it's controversial, but I work there because it's not like it used to be, okay? And I would never have worked in the environment that it used to be, okay? But it's always, how do we get people to yes now? That's the philosophy of CMH's clinic now. So even if someone's not quite ready for whatever reason, it's how do we get them to, yes, you're approved, we can go ahead, okay? And that's the philosophy of the clinic now. And it was, it still is a gatekeeper. It was very much more so a gatekeeper in the past. We do believe that people do better after these surgeries that they're asking for, and that the rates of regret are so low that it's just not something that we really worry about anymore. It was something we really worried about in the past. Coverage is province to province, so it depends on where you live. Provincially here in Canada, how many of these surgeries and what is covered and what is not. So we'll go through that a little bit more at the 9 o'clock lecture, but these are possible surgeries, not all of which, in fact most of which are not covered by OHIP. Very quickly, there are different ways of asking the questions with respect to gender, and you have to find a way that sort of works for you that's respectful, okay? But these are some of the options that you can ask people, but you have to keep in mind that you have to know why you're asking the questions and whether it's really important for the issue at hand, okay? So if, for example, someone is going into the emerge with an injured finger, okay? Dr. Mazzarella has a broken finger. So if someone is coming into the emerge for something like that, do you really need to know what their gender history is and whether they've had any genital surgeries? Does it matter? It doesn't matter, right? So, as you're sort of trying to figure out what questions would you feel comfortable asking somebody about their gender or transgender status, you have to think, why am I asking these questions and is it appropriate in this context? Some other possible questions that you might want to ask. And a lot of the questions are about people's self-identity and about if they do identify as transgender, their coming out process and how many people are they out to, what was people's reaction. It's more assessing that than somebody's legitimacy as a transgender individual, right? That's not really people's role to decide that. This is from Asking the Right Questions 2, which is a document that's available for free on the internet. It's produced by CMH. And this is some suggestions about how you can actually put this on your forms. Okay, so intake forms to whatever service usually have male, female as options for identifying someone's gender. You usually don't have any other options. So these are some other options that you can put on your forms. And it's a relatively easy thing to make your practice, your health center or wherever you're working, a more trans-positive environment. I don't know that I love this first question. It is from asking the right questions too. At what age did you first identify as transgender or genderqueer or lesbian or gay or bi or whatever? So they do have that listed as a question. It's sort of like, well, at what age did you first identify as straight or as cisgender? Like it's sort of, to me, a silly question, but it is one of the questions, and asking the right questions too. The rest of them I do like. But again, you have to find what works for you and in the right context with the